We're coming to you from Johannesburg Management Area, Maximum C, also known as Sun City, where Justice Minister is to launch vaccination program for inmates. Thank you so much for your time, Minister. Can you just tell us why now and not previously? I heard you say that, in fact, it started when the 60-year-olds also started.
Yes, the inmates have always been vaccinating with the categories in society. When the people that are above 60 were vaccinating, also inmates were vaccinating. We had a population of about 500 and something of the older ones. And also when it was 50 to 60, they were also vaccinating. But now we need to go on a large scale because it's sectoral, it's for essential services for the officials and also for the inmates because here it's an overcrowded place. It's largely people live in a congested area. So it's important that they get the vaccine to avoid any severe illness and to manage the outbreaks. And it is to protect not only the inmates and the officials, but to protect society as a whole.
Yeah. And there's also been criticism about the slow pace of those on parole who are supposed to actually be let out of prison, saying that this could be an instrument you can use to reduce overcrowding in prisons. What's your reaction to that criticism?
That criticism is unfounded because we have already done what was called a special parole dispensation for COVID-19, and we have released a huge number of inmates, about 14,000 of them, that have been released and are now managed under correctional community corrections. So what we are embarking on now is the vaccination of all the inmates across the country. And obviously those that are on parole, they also can vaccinate through the community where they stay, because obviously they have the required IDs and so forth, and they must just follow their age category and go to the health centers in the community and in society to be vaccinated.
And how are you going to prioritize the cases of the rioters? We heard that the Justice Department say that it's going to prioritize expediting all these cases to get them out of the roll, and also dealing with overcrowding, because it was a huge number of people that have been arrested in KZN and in Gauteng.
Yeah, obviously with the collaboration between the National Prosecuting Authority, Correctional Services and the judiciary and all stakeholders, they have found a way where they can be able to manage this huge number that is coming. They are dealing with it in a prioritized role that will enable them to dispense justice as quickly as possible. But within the centers, what we do is that all those inmates that are coming in the various centers across the country, they are quarantined together so that they don't mix with the inmates who are already inside to manage the disease. And if those that show symptoms or those that already knows that they've been infected, they present themselves to our healthcare officials who then test them and then take them through the medication processes.
And I heard you say that attempts to destabilize correctional facilities last week actually failed, as instigators actually attempted to try to reach out to the inmates so that there can be instability. Can you elaborate on that?
Yes, they were mobilizing through WhatsApp, through voice notes, through various means of communication to instigate anarchy, that the inmates must cause an attack to the constitutional order in our society. But the inmates rejected those things with the contempt it deserve, because these are patriotic South Africans. These are very loyal people to the Constitution. They are also loyal to the rule of law. So they rejected it as some agent provocateurs who are trying to destabilize the country and the Constitution. And the inmates said they are standing with the rule of law. They stand with the Constitution. They stand with the people of this country. And they also, some of them condemned this act of violence and rioting and looting. So you can see that those attempts could not succeed because of them refusing to participate in an agenda that they have no knowledge about. The inmates do have grievances, they raise them, and from time to time we attend to the grievances when they are raised. So they know the protocols and the procedures to attend to their grievances. Hence, they rejected this project by agent provocateurs to hoodwink them to some destabilization program.
How confident are you to reach the deadline of the health department in terms of vaccinating all inmates?
We are very confident because the inmates, they are coming forward, the officials, they are coming forward, and the numbers, as you can see, are trickling in, which encourages us that we'll be able to reach that deadline. If we are able to vaccinate about 8,000 a day, we will be able to reach the deadline that has been set for us by the Department of Health.
Thank you so much. That was the Minister of Justice, Ronald Lamola, actually saying that he's quite confident that if they can vaccinate about 8,000 inmates daily, they will reach a target that was set by the Department of Health, which has offered them the J&J vaccine in order to vaccinate inmates here and nationally. There's been about 90 sites that have been approved for inmates to actually go and vaccinate. And with that, it's back to studio.